the sugar today is not the same sugar as it was 30, 40 years ago. My parents' generation, they didn't really worry about carbs, protein, fats. They didn't know, right? But there wasn't this obesity problem because we've got these processed foods that have the high concentration of sugar, the artificial ingredients, the toxins, all of these things stacked into one time bomb. Um, and the sugar consumption is causing the heart disease. So if you could get into how the sugar consumption and insulin resistance is also leading to a lowered amount of nitric oxide in the body. Like it's almost like what came first, the chicken or the egg? If you took someone that is on a high processed food diet who has heart disease, and they don't change their diet, but you help them get rid of their fluoride toothpaste and their mouthwash and their PPIs, will their insulin resistance come down because their nitric oxide might go up? Or is it something where you've got to address all of the factors?
Well, I think it's always best to address all the contributing factors. But here's what we know from the basic sciences is that when you lose the ability to produce nitric oxide, that's what leads to insulin resistance and type 2 diabetes. Because nitric oxide is part of the insulin signaling pathway. That when insulin binds to the insulin receptor, it activates a number of intracellular signaling pathways, whether it's AMP kinase or PI3 AKT kinase. But those converge on the enzyme to make nitric oxide. And if the cell can't make nitric oxide, then GLUT4 never gets the signal to go to the membrane, bind glucose, and bring it in from the circulation. So insulin resistance is a symptom of nitric oxide deficiency. And then you got to figure out why isn't the cell able to make nitric oxide? Well, are you using fluoride toothpaste? Are you using mouthwash? Do you have an elevation of ADMA? Are you consuming too much sugar? Because here's what happens at the end of the day. Sugar is the problem. Sugar is a poison. It's a toxin. It's one of the most addictive molecules known to man. And table sugar is sucrose, right? But it's metabolized into glucose in the cell and in the human body. And glucose is like a glue. And we've all seen this. If we spill a soda or a sugar beverage on the tabletop, we come back the next day, it's sticky, right? It's just a sticky mess. So sugar is sticky, and sugar sticks to protein, sugar sticks to enzymes, and it sticks to hemoglobin, and we call that hemoglobin A1C. And it's a measure of long-term insulin control or glucose control. So, but it sticks to every other protein and enzyme. So glucose will stick to nitric oxide synthase, and proteins and enzymes have to have some degree of flexibility. They got to undergo conformational change. But if we got a lot of sugar stuck to it, it basically locks it into one conformation. So this then activates enzymes, including nitric oxide synthase enzyme. So we have to stop using sugar, and it's not just sugar; it's high fructose corn syrup. Fructose is a huge toxin, leads to upregulation of uric acid, which shuts down nitric oxide production. Mm-hmm. So we have to first start with what's contributing to your disease or your symptoms. And most of the time, it's overconsumption of sugar. So I tell people you got to avoid sugar, avoid gummies and chews. There are a lot of companies out there selling nutrients in the forms of gummies or chews, which all it is sugar and seed oil. I mean, those are the last two things Americans need in their diet is sugar and seed oils. So gummies and chews are one of the, I think, biggest scams in the nutritional supplement industry because they're contributing to the disease. They're not leading to any benefit on anything they're delivering because, again, in that sugar matrix, there's sugar stuck to the whatever ingredient they're trying to deploy, and it becomes inactive. So you basically poisoned those nutrients and ingredients by putting them in a gummy or chew. But to get back to answering your question, I think if we reduce sugar consumption and carbohydrate consumption, and then start doing the things that promote and stimulate nitric oxide production, you can completely overcome insulin resistance type 2 diabetes. The other problem in both of our parents' lifetime was they worked. They were physically active. So they could probably get away with eating a little bit more sugar because they burn it. But now people sit around, they eat food, a lot of sugar foods, processed foods, and nobody exercises. We're an immobile society, and if you take in more calories, you don't burn them, those calories are going to be stored. and then you continue to graze throughout the day. You see a blood sugar increase, and glucose sticks to proteins, and we develop disease. It's really that simple. Medicine has become way too complicated. The etiology of every single chronic disease is really pretty simple.
You mentioned seed oils, and that's a hot topic now. And I actually did a podcast on seed oils. This was also not a concern in our parents' generation because they weren't just overloaded in these processed foods. And so, yes, you would eat a little bit, but the body handled it and it was fine. It was not a big deal. Can you explain seed oils and nitric oxide?
Well, the membrane of cells that make up the human body have a bilayer, a phospholipid bilayer. So in that phospholipid bilayer, there's fatty acids, there's cholesterol, there's all types of lipids. And the cell membrane is kind of like a barrier. But in that, we have to have cholesterol to maintain some cell mobility. But integrated into that cell membrane are these transmembrane receptors or proteins. So when we have an agonist that binds to the outside, it's got to transduce that signal through the cell membrane and activate these intracellular signaling. So in seed oils, you basically start integrating these fatty acids, and then you lose membrane fluidity. You basically lose the intracellular signaling because the content of the lipids and the fatty acids are completely changed. So you basically just shut down the intracellular and extracellular environment, and that's how cells in the body communicate. And the half life of these, I think, are 37. I mean, they're weeks, 37 days, or maybe even longer, maybe even months. So once you consume these, they maintain in your body for a prolonged period of time. So if you continue to consume these seed oils, the integrity of the cell membrane and every cell in the body becomes compromised, and you can't signal. You can't bring in glucose. You develop insulin resistance. You develop, cognitive disorders, many things. So they have to be avoided. And cholesterol has been demonized for the past 40 or 50 years, and we need cholesterol. We need cholesterol to make vitamin D. We need cholesterol to maintain the integrity of the cell membranes. We need cholesterol to make testosterone and estrogen.
Mm-hmm.
So the worst idea I could ever think of as a biochemist and physiologist was getting patients' cholesterol below 200. I mean, that's the absolute worst idea in the world. And yet that's the target now. And
Yeah.
people aren't getting better, they're getting sicker. And to me, it's completely explainable.
My cholesterol, I just got it done. It was over 200, and I had the red H telling me that it's too high. And it's
Don't pay
that
attention to it.
initial I did something wrong. But then I think about it, I'm like, no, it's actually really good. And my HDL is great. So anyway,
Well, look, your body makes cholesterol,
right.
right? And so your body makes what it needs. And so if you inhibit endogenous cholesterol production, your body can't respond and do what it's just. So, I mean, again, I think it's the greatest myth ever perpetuated on the American society, or the world public, and it's detrimental to health. So we need cholesterol. We need healthy cholesterol levels. And I think if you look at the Framingham data, the people who live the longest have cholesterol between 240 and 260. So
Right.
why was there ever a target to get it below 200? It makes absolutely no sense scientifically.
Well, this brings up the question of people on cholesterol lowering drugs. Does that affect their nitric oxide levels?
Absolutely, on several ways. So number one, these cholesterol lowering medications, the statins, are mitochondrial toxicants. So they're inhibiting mitochondrial energy production. That's why you see the myalgia, the muscle cramps, pains that a lot of people suffer from cholesterol lowering medications. The other thing, as I mentioned earlier, is that if you inhibit cholesterol production, you get less cholesterol that's deposited in the cell membrane, so you're losing that membrane fluidity. So you disrupt intracellular signaling. There's clear evidence now that people who've been taking statins for a number of years have an increased risk of, or increased, not risk, increased incidence of insulin resistance and type 2 diabetes.
Mm.
Now there's data coming out because of the mitochondrial toxicity that these drugs can actually lead to cancers, and inducing what's called the Warburg effect, and creating an environment where cancer cells grow and proliferate. So for me, when I look at the risk benefit of anything, what's the risk of taking a cholesterol lowering medication versus the risk? What's the benefit? There is no benefit. So there's no reason somebody should be taking a cholesterol lowering medication. What are the risks? Oh, diabetes, cancer, metabolic disease, loss of nitric oxide, muscle cramps, muscle pains, low vitamin D, low testosterone, low estrogen if you're a woman. Now you become immunocompromised, you got muscle aches, muscle cramps. For what? For zero benefit.
Yeah.
In the late 80s and early 90s, the American Heart Association, when these drugs were first discovered and approved to lower cholesterol, American Heart Association predicted by the turn of the century it would completely eradicate cardiovascular disease because they thought cholesterol caused heart disease. If we lowered cholesterol, we would eliminate cardiovascular disease. These drugs have been on the market now for 40 years, and cardiovascular disease is still the number one killer of men and women worldwide. And now we have this growing list of other syndromes and symptoms that can all be explained and are related to the use of cholesterol-lowering medication. Makes no sense.
I love that you talk about this, the cellular health and the cellular membrane, that lipid layer, and the seed oils and how they disrupt it, because I describe it as we are only as healthy as our mitochondria or our cells. And if we cannot get the nutrients into the cells or the toxins out, you've got the insulin is your body's going to become insulin resistant even without the sugar. Yes, sugar makes it a lot worse, but even with these seed oils that have no sugar in them, right? No carbs, and so we're okay if it's low carb and it's no sugar. No, that is insulin's going to be knocking on the door at that cell level, and
Nobody's
the cell's
home.
going to say, right, no one's answering,
No one's
you
home.
go somewhere else, I'm going to become insulin resistant. So with that, is it the blood sugar or is it the insulin that is the problem with nitric
Well,
oxide?
I think it's both. Because chronic elevation of blood sugar tells the pancreas to secrete more insulin, and so it's the chronic hyperglycemia and hyperinsulinemia that leads to the induction of all these inflammatory pathways. If we have normal metabolic flexibility, and if for instance, if we go and we fall off the wagon and I eat a bowl of ice cream and my blood sugar elevates, then I just secrete more insulin. Insulin gets glucose into the cell, then insulin levels drop, and there's never this chronic level of hyperinsulinemia. But in people who become insulin resistant, their blood sugar goes up. It tells the pancreas, hey, I need more insulin. They secrete more insulin, but insulin's resistant, so insulin doesn't improve glucose uptake into the cell. So insulin never goes back down because there's always crosstalk between the beta cells of the pancreas and circulating levels of blood glucose. So it's the chronic hyperglycemia, the chronic hyperinsulinemia that drives inflammation, that drives vascular disease, that drives the metabolic disease. So if we can just improve insulin sensitivity, because we never want to lose the ability of the pancreas to secrete insulin because we need it. But that insulin has to be functional and able to signal that cell to bring glucose into the cell, and then store it as glycogen or metabolize it for ATP or the number of different metabolic pathways for glucose uptake and glucose metabolism.